Hello, Miriam Gaudelli, sports massage and lymphatic drainage massage therapist. Today I would like to talk to you about one of the side effects of certain types of cancers, mainly uterine, breast, skin, and testicular. And this side effect is called lymphedema. When you have these types of cancers, the cancer, if it's spreading throughout the body, will go into the lymph nodes. So surgeons will go and remove these lymph nodes to test them to see if there's cancer in them. Now, once you remove lymph nodes from the body, that will completely change the lymphatic pathway. So it will make it more difficult for the body to process and distribute the fluid that is in your limbs. Over time, what happens is this fluid starts to settle in the limbs, either your arm or your leg. In a double mastectomy, it would be both arms. In the case of uterine cancer, it could be both legs. So it really depends on what happened, what the case was, how bad the cancer was, how much it spread. And that will also dictate how many lymph nodes they do remove. So what's important is that once your oncologist gives you the okay, tells you you're fine, and suggests you to get lymphatic drainage, or in some cases, even if they don't suggest it, you might want to ask them about lymphatic drainage. It's important to get a consultation right away. Now, unfortunately, the harsh reality is that in Quebec, the wait times for the lymphatic drainage treatments in the hospitals are between 6 months to 2 years, depending on the hospital you go to. So if you have the funds and if you have health insurance, it might be a better idea to find somebody who can do these treatments for you privately. Why? Why is it so important to get this treated before it really becomes a problem? Well, if there's only a 1 centimeter difference from one arm to the other, then it won't really unbalance you too much yet. It won't really cause any neck problems or back problems or hip problems. But if you get to the point where there's a 10 to 20 to 30 centimeter difference between one limb and the other, then you can bet that you're going to have a lot of problems in terms of your alignment, in terms of how your body feels. And it can cause a lot of pain in the long run. It can cause herniated discs, sometimes a bit of nerve damage because if you're always walking crooked or moving crooked. Another reason, if you wait for your limb to really change size, then you might not be able to wear some of your clothes anymore, and it will become very difficult for you to purchase clothes. I've met people who were no longer able to wear pants because one leg was so much bigger than the other one, and so they always had to wear long skirts because they also didn't want people to see their leg. Now, there's also the case of the health aspect of it. So, lymphedema in itself, especially in the beginning stages, is not a health problem. But lymphedema does increase your chances of getting cellulitis, which is a deadly skin infection. Getting cellulitis will increase your lymphedema. Increasing your lymphedema increases your chances of getting cellulitis, and it's a vicious circle. Actually, people with lymphedema have cellulitis in about 70% of the cases, whereas in the non-lymphedema population, only 7% of people get cellulitis. So that really shows you the connection between cellulitis and lymphedema. Something else that can happen, your skin changes consistency. Whereas it used to be once uniform and soft, it will become dry, scaly, brittle, red. It could develop sores where if the lymphedema is really too much for your body to handle, the fluid will start to leak out, and that's really not a desirable effect because aside from it not being aesthetically nice, it increases your chances of having severe skin diseases and illnesses 100-fold. The other side effect of lymphedema is the fact that over time, if you really leave it for too long, then fat cells will deposit there. When you have too many fat cells, it also increases the chances of getting another tumor. If the tumor grows in the lymphedema, it's hard to diagnose, and unfortunately, it is deadly in most of the cases. So that's really something you don't want to go through. So how can you prevent this lymphedema? Once your oncologist tells you you're fine, your surgeon tells you you're fine, and you can move on and get other treatments, then consult a lymphatic drainage massage therapist. If you have the insurance and the funds, go privately. If you don't, go on the waiting list for the hospital, as long as you get the treatments in the long run. Something else that you can do is exercise. Exercise helps to prevent the accumulation of this fluid, so that will also be helpful for you. That's why there are so many dragon boat teams for people who have had breast cancer, because it is very useful and they are making a lot of use of their arm, which decreases the chances of the swelling. Once the lymphatic drainage massage therapist has finished their treatments, they will suggest that you go get fitted for a custom garment. It is very important that your garment is made just for you. What you buy at the pharmacy is not made for your arm, and the pressure is not distributed properly for your arm or your leg. So very important to find a place that makes custom-made garments and that they will be measured properly and a professional takes all of the measurements. Your lymphatic drainage massage therapist will be able to tell you when it's time for you to go and get fitted. Unfortunately, in cases where people had a huge difference in limbs, I mean, I've seen some people that one limb was about 5-6 times the size of the other one, the skin will have stretched out, so the leg will never be exactly the same size as the other one because there was so much extra skin. But if you can get it to the point where the difference is healthy and the difference is only the extra skin, then you've really won a huge battle. But remember, as much as after somebody has had cancer, they just want to say, I'm done with the professionals, I'm good, I'm fine now, and congratulations when you get that clean bill of health. But there are other side effects that you need to consider. So please consult so that you don't have long-term side effects that could be aesthetically damaging, but also damaging to your actual health. Remember to take care of your body. You only have one. Have a good day.